This presentation on pesticide safety is presented by the Montana State University Extension Pesticide Education Program. This presentation is intended for Montana private pesticide applicators and covers pesticide toxicity, routes of exposure, applicator safety, personal protective equipment, storage, and equipment cleaning. The first section of this talk will cover applicator behavior, hazard, toxicity, and mode of entry. Take a minute to think about this question. Do you see any issues with the way this question is worded? The safety of pesticides is a misunderstood topic and often depends on a person's opinion and not on scientific fact. It depends on your background, experience, and education, among other things. In other words, it is not an accurate way to describe a pesticide. Instead of using safety, we use the term hazard. A pesticide's hazard depends on the toxicity of the pesticide and your exposure to the pesticide. If you reduce either the toxicity or the exposure, you will decrease the risk associated with the use of pesticides. You can decrease the toxicity by choosing a lower toxicity pesticide. You can lower your exposure by doing things such as wearing personal protective equipment and reducing the amount you spray. We define safety within the definition of toxicity. Paracelsus, considered the father of toxicology, determined that the dose makes the poison, meaning anything can be toxic in excess. An example is a few aspirin may fix a headache, but the entire bottle could be fatal. The more toxic a substance is, including pesticides, the less exposure is needed to be fatal. This video is an example of a pesticide application gone very wrong with an extremely toxic pesticide.
They were just such a great family, and they really knew what it was to be a family.
Family and friends gathered for a vigil to remember 4 children who were accidentally poisoned by pesticide.
It only takes 50 drops in a room full of a million to be able to become toxic and kill you.
Firefighters in Amarillo, Texas say the Balderas family was trying to get rid of mice in their home and didn't know how toxic the pest control chemical was.
The chemical is sold to only people that have a license to apply it, and he got this black market.
10 people were living at the home, 9 were rushed to the hospital.
They found one child that was already unconscious and unresponsive. They pulled the child out of the house, started doing CPR on that child. Rescue efforts were unsuccessful. Unfortunately, that child was pronounced dead later at the scene.
The chemical, aluminum phosphate, when mixed with water, creates a deadly gas, which is what investigators say is to blame for this tragic accident. It's unknown how long they were exposed to the gas. No charges are expected.
The respect and the support that this community has for each other is just phenomenal.
For InsideEdition.com, I'm Lee Sheps.
Many different things were done wrong with this application. The applicator was not licensed and obtained the pesticide illegally. Therefore, he did not have an understanding of basic pesticide safety or how to read the label. The applicator ended up killing 4 of his children. In 2009, we surveyed private applicators in Montana about their pesticide use practices. This graph shows 1/3 of Montana applicators have been affected by pesticides, which means they either did not take proper precautions while using a pesticide, or they were victims of someone else not using pesticides properly. Our next question is, why is this happening? The results show the majority of private pesticide applicators in Montana either knowingly do not wear proper PPE or are unaware of what PPE they should be wearing. This means these people were exposed to the pesticides they were applying, increasing the hazard associated with the pesticide application. The results lead us to this question. Are there reasons why we are not protecting ourselves? Look at the photo on the left. Wearing a full coverall is extremely uncomfortable. These Tyvek or Tychem suits are extremely hot. At 80 degrees Fahrenheit, you can have temperatures exceeding 100 degrees Fahrenheit. This is a sauna that, if not seen as absolutely critical, often is overlooked. However, protecting your skin protects the first mode of entry called dermal, which is the most common way to be exposed to pesticides. What is the problem with wearing nitrile gloves often recommended on the product label, such as the middle photo? Let's say you have a plug nozzle and are in need of changing the nozzle. Using these gloves reduces dexterity. What do you do when you cannot get the nozzle free using these gloves? You may take off the gloves, replace the nozzle, and often put gloves back on, exposing your hands to pesticides and actually trapping pesticides against your skin. This is another example of dermal exposure. 97% of pesticides enter the body through dermal exposure. In Montana studies, 79% of private applicators remove gloves at some point in their career when working with pesticides. In the middle photo, what is the problem with wearing eye protection, in this case goggles? Eye protection frequently fogs up in as little as 15 minutes of exertion in warm conditions. What do you do when your goggles fog up? You often take them off, wipe them clean with contaminated gloves or hands, then put contaminated eye protection back on, which exposes your eyes and skin on your face to pesticides. Eyes easily absorb pesticide vapors and are extremely sensitive to pesticide exposure. Ocular is the second route of exposure. What is the problem with wearing respirators like in the right-hand photo? Respirators are uncomfortable. They protect the wearer from inhalation exposure, or the third route of exposure. So we identified 3 routes of exposure. What's the 4th route? The fourth mode of entry is through ingestion. It sounds like common sense to not ingest pesticides, but it is easy to get into your mouth if you forget to wash your hands. You can easily get pesticides into your mouth through eating, drinking, smoking, or using your phone. Additionally, accidental ingestion happens when pesticides are not stored correctly, and the pesticides come into the hands of children or other people who are not aware of the hazard. The dermal mode of entry accounts for 97% of pesticide exposures through dust, splashes, spills, mists, or residue. Certain areas of your body absorb more, including your hands, which are a likely place to be exposed to pesticides. Oil-based products are generally absorbed at higher rates. The longer you are in contact with a pesticide, the more you will absorb. Inhalation is another mode of entry or route of exposure. Inhalation can cause contact damage to your mouth, throat, and lungs. It can also cause systemic damage from the pesticide entering your bloodstream rapidly. This can potentially cause damage to the nervous system or other organs. You can inhale liquids, aerosols, gases, or dust in the air. Another mode of entry is ocular or through the eye. Eye exposure will most likely occur while mixing and loading, but can also happen while spraying. Eye tissue is very absorbent and can cause eye damage or blindness. Remember to keep your hands away from your face, as this is an easy way to expose your eyes. To review, there are 4 modes of entry, or ways to introduce pesticides into your body. The most prevalent is through your skin, or dermal, because it is the easiest for pesticides to contact. You can also ingest or inhale pesticides or get pesticides into your eyes. When you've been exposed to pesticides, you can have different symptoms depending on the mode of entry and the pesticide you are exposed to. You may get local or contact symptoms on your skin, eyes, nose, mouth, or throat. You can also experience systemic effects due to absorbing a pesticide, including nerve damage, impaired blood clotting, cancer, reproductive issues, impaired metabolism, hormone effects, or organ damage. Additionally, anyone can be allergic to a pesticide, and most likely they wouldn't know unless they've already been exposed. Allergic symptoms can be local or systemic and may include respiratory problems, hives, or itchy eyes. Part of determining the hazard equation is toxicity. Toxicity is a measurement of how harmful a pesticide is to humans. Testing for acute toxicity is required by the EPA and active and inert ingredients within a pesticide formulation. The acute toxicity is used to determine a pesticide signal word printed on the label and is related to the LD50. An LD50 is the lethal dose at which 50% of a population is killed. This is expressed in parts per million and is measured on rats. If you have one chemical with an LD50 of 100 parts per million and another chemical with an LD50 of 10,000 parts per million, which is more toxic? The chemical with an LD50 of 100 parts per million is more toxic because it takes less to produce a toxic effect. This graph shows a comparison of LD50s for several pesticides and other common chemicals. The lower numbers are actually more toxic than the higher numbers. One way to think of it is that less of the chemical you need to be lethal, the more dangerous it is. It takes less of these products to kill per kilogram of body weight. This graph also brings us back to the idea of the dose makes the poison. Why does a cup of coffee in the morning not kill us? As you can see, caffeine has an LD50 of 192 milligrams per kilogram and is on the more toxic side of the chemicals presented in this graph. Coffee in the morning doesn't kill us because the amount or dose of caffeine in coffee is extremely low. Toxicity information is communicated to applicators on the pesticide label in the form of a signal word. Every product is analyzed for its toxicity and given a signal word as outlined in this graph. Danger, poison, and danger are the most toxic. A few drops to 1 teaspoon of the product will kill a 160-pound per adult. Warning means the product is moderately toxic, and 1 teaspoon to 1 tablespoon will kill an adult. Caution means the product has a low toxicity, where 1 tablespoon to a pint or more will kill an adult. Some pesticides may not have a signal word, and these are the least toxic. Remember, these values are based on the average adult. Children can be killed with a quarter of the amount required to kill an adult. Can you identify the signal word on this Roundup Ultra label? The signal word is caution and is identified on the first page in capitalized letters. How about for this Warrior label? The signal word is warning, meaning it is moderately toxic. The Gramoxone label has a signal word of danger, poison, which means this is a very toxic product. When you see the signal word, it is also accompanied by poison in capitalized red letters and a skull and crossbones. The difference between danger, poison, and danger signal words are that products with danger, poison signal words are highly toxic by any route of exposure. Products labeled with danger signal words mean that the product is highly toxic by at least one route of exposure. It may be corrosive, causing irreversible damage to the skin or eyes. Chronic toxicity is from many low-dose exposures over time. This can happen from pesticide applicators not wearing proper personal protective equipment. The EPA requires testing of active ingredients for chronic toxicity and classifies inert ingredients into 4 different categories. The label communicates chronic toxicity through terms like carcinogen, mutagen, and reproductive damage. Here's an example of an applicator who did not follow the product label PPE requirements of a lower toxicity insecticide called permethrin. This individual, while grossly negligent in following the label PPE requirements, also had an autoimmune disorder. Underlying health conditions can cause hazardous chronic toxicity even with a low toxicity product. Immune system reactions to permethrin cause skin rash and lesions. In this case, the condition was reversible. Once again, individuals with autoimmune disorders are at a higher risk at developing chronic or delayed health problems. The Agricultural Health Study assessed the health impacts of over 90,000 private applicators from a lifetime of pesticide use. This study concluded there were associations with many long-term health impacts from pesticide use not previously known through typical toxicological assessment. Chronic toxicity from using paraquat, parathion, malathion, and others were associated with respiratory issues. Additional agricultural health study conclusions found that pesticide applicators who used pesticides more than 400 days in their lifetime were 2.5 times more likely to have Parkinson's disease. This finding was specifically associated with paraquat and rotenone use. In the next section of this presentation, I will cover personal protective equipment, first aid, heat illness, and cleaning equipment. I've already used the term PPE, or personal protective equipment, in this presentation. PPE consists of gear you use to minimize your exposure to pesticides, including coveralls, gloves, footwear, aprons, headgear, eyewear, and respiratory protection. The pesticide label will tell you exactly what types of PPE you need to wear and what the materials should be made of. Some labels will not have any PPE listed, and these will be lower toxicity products. However, you can still reduce your exposure by wearing the basics. We recommend always wearing long sleeve shirts, long pants, closed-toe shoes, and socks when applying any pesticide. Remember, 97% of exposure to pesticides is through the skin, so by covering the majority of your skin, you are greatly reducing your exposure. A very useful type of PPE are coveralls. There are two main kinds: unlaminated, which are not chemically resistant, and laminated, which are chemical resistant. A pesticide label will probably not require unlaminated coveralls, but they can be really useful to have. They are an additional barrier over your clothing that you can easily remove when you're done applying pesticides. What this does is reduces the amount of pesticides on your clothing and the amount of pesticides you take home with you. You may choose to use an unlaminated coverall with low toxicity products that say on the label to wear long sleeve pants, shirts, or woven coveralls. If a pesticide label requires chemical resistant outerwear, then you must use the laminated coveralls or something similar like a rubber rain suit. These can be used multiple times if cleaned properly after use and there is no material breakdown. If there are holes or thin spots in the coverall, throw it away and get a new one. These coveralls will be required for some pesticides with warning or danger signal words. The type of gloves you need will be listed on the label. Never assume you should use a certain type, as some may not be protective against the pesticide you are using. The label will list the type of material and thickness. Never wear leather, cotton, or lined gloves when applying pesticides, as these can absorb the pesticide and hold it against your skin, facilitating absorption. Do not use latex gloves, as these can have chemical reactions with certain pesticides. If a label does not require gloves, it is still recommended you wear, at the very minimum, disposable nitrile gloves to protect the skin on your hands. Again, the pesticide label will tell you what type of eye protection you will need. Options range from simple safety glasses to goggles and face shields. Do not wear contacts when applying pesticides, as they can facilitate absorption of the chemical into your eyes. Wearing proper footwear is very important, as you could be walking through areas you have sprayed. Unlined, chemical-resistant boots are important when applying pesticides with warning or danger signal words. The boots need to be washed after every use and only used for pesticide applications. Do not wear leather boots, as these can absorb pesticides. Respiratory protection is used to protect a pesticide applicator from inhaling pesticides. Not all pesticides require the use of a respirator. Again, the label will tell you when a respirator is necessary and what kind to use. There are two kinds of respirators. The first is atmosphere supplying, meaning the air you breathe is supplied by the respirator. These kinds can be required in very specific instances, but they are not commonly used. We will mainly focus on the other kind, which are air purifying respirators, meaning they filter the air that you breathe. Air purifying respirators include particulate, chemical cartridge, a combo of the two, and gas masks with canisters. The page numbers listed are where you will find this information in the EPA Core Manual. Particulate respirators are one type of air purifying respirator. They only remove particulates and not gases or vapors. Every respirator has a NIOSH, or the National Institute for Occupational Safety and Health, approval number. You will need to use the respirator with the approval number listed on the label. Particulate respirators also have a oil resistance rating, N means not oil resistant, R is oil resistant, P is oil proof. Particulate respirators also have a filter efficiency, telling you how much the respirator filters out of the air. These are usually 95, 99, or 100%. Another type of air purifying respirator is a cartridge or canister respirator that remove gases and vapors from the air. You must get a specific cartridge for the chemical you are using, as listed on the pesticide label. This type of respirator can also be used with a particulate filter. The canisters for these respirators must be used according to manufacturer guidelines. Once a canister has been opened, there is a limit to how long it will last. Open cartridges can be stored in sealed containers to extend their life. Never use a cartridge that is past the expiration date. If a pesticide label requires respirator use, then applicators are required to have a medical evaluation and fit test prior to applying pesticides. This can usually be completed at your local hospital if they have an occupational health department. This evaluation determines you are medically able to handle the stress of wearing and using a respirator. When you first buy a respirator, you must get a fit test to make sure you buy the proper size respirator. This can be done at a local hospital, by safety companies, or by using fit testing kits available for purchase. This should be done annually. Additionally, every time the respirator is worn, you must perform a seal check to make sure there are no leaks. The following video instructs you how to do a positive and negative seal check. You need to do this check every time you use a respirator prior to being exposed to the chemical or pesticide.
User seal check. Always check the seal of the respirator to your face before entering a contaminated area. You must perform either a positive or negative pressure user seal check. To perform a positive pressure user seal check, place the palm of your hand gently over the exhalation valve cover, being careful not to apply too much pressure and disturb the face seal. Exhale gently. If the face piece bulges slightly and you feel no air leaking between your face and the face seal, your respirator has sealed properly to your face. To perform a negative pressure user seal check with cartridges, first cover the open area of the cartridge with the palms of your hands. Filter retainers may aid in conducting a negative pressure user seal check. To perform a negative pressure user seal check with the round 2000 or 2200 series particulate filters, position your thumbs over the center of the filters to restrict airflow through the filter. To perform a negative pressure user seal check with the rectangular 7000 series particulate filters, squeeze to compress the filter. After you've sealed the filter or cartridge inlet, inhale gently. If the face piece collapses slightly and you feel no air leaking between your face and the face seal, your respirator has sealed properly to your face. If you detect air leakage when conducting either the positive or negative pressure user seal checks, reposition the respirator on your face or readjust the tension of the straps. Then repeat the user seal checks. If you have any difficulty getting the respirator to fit, review the user instructions in the packaging or the fitting instructions provided by 3M to be sure you are putting it on correctly. If your respirator still doesn't fit correctly, see your supervisor. A user seal check must be performed every time you put on your respirator. Never enter a contaminated area if your respirator does not seal properly. Always check the seal of the respirator to your face before entering a contaminated area.
Remember, you need to wear PPE whenever you may come into contact with the active ingredient of the pesticide. This includes mixing, loading, handling, or applying the pesticide. Whenever you enter into a treated area still within an REI or restricted entry interval. You also need to wear PPE while you are cleaning your application equipment, tanks, empty product containers, or PPE. Here's an example of a paraquat PPE statement. Paraquat is one of the more toxic pesticides commonly used in Montana and has extensive PPE requirements. This part of the label has been separated by task. The first section lists PPE for applicators and other handlers, including long sleeve shirt and long pants, chemical resistant gloves, shoes and socks, protective eyewear, NIOSH approved particulate filtering respirator with an approval number TC84A. Next, it lists what mixers and loaders must wear. This is a separate section because while mixing and loading, you are more likely to come into contact with the concentrated active ingredient, which is highly toxic. Mixers and loaders must wear everything listed for an applicator, but must also wear a chemical-resistant apron and face shield. The respirator listed here could technically be a dust mask if it meets the TC84A number. However, we highly recommend never using a dust mask where a respirator is required, as they are difficult to get a proper fit and seal. Purchase of a half or full face mask respirator with the proper cartridge is recommended to make sure you are fully protected from highly toxic pesticides. Another section of the label which lists PPE requirements is within the Ag Use Requirements box or the Non-Ag Use Requirements box. While a treated area is under a restricted entry interval, anyone entering the area must wear the proper PPE listed to protect themselves from residue. Determine if your use falls under the Ag Use or the Non-Ag Use based on the type of site. Within the proper section, you will see a list of PPE required for entry. In this case, on the milestone label, there is an REI of 48 hours, and entry into the treated area prior to the end of the REI requires you to wear coveralls, chemical-resistant gloves, shoes, and socks, and protective eyewear. However, the non-ag use requirements box lists restricted entry until the sprays have dried. If you will be using any fumigants such as aluminum or magnesium phosphide, the PPE requirements are very different. This is one reason why it is extremely important to read the pesticide label, as the wrong PPE could be fatal. Fumigants are highly toxic, so you must prevent inhalation and absorption of the gas into your body. Fumigants are solids that, when in contact with moisture in the atmosphere, release a toxic gas. For this reason, the PPE for fumigants allows for breathability by wearing long-sleeve pants, shirt, shoes, and socks, and cotton gloves. You do not want to wear chemical-resistant gloves or coveralls, as the fumigant may get trapped against your skin and absorb into your body. Fumigants also require a gas mask with a specific canister for phosphine gas. There are several instances where you need to wear PPE when you are not actively applying a pesticide. One of these is when you are dealing with empty product containers. Product containers usually must be triple rinsed, with the rinsate being sprayed on a site listed on the label. The container then must be punctured and can go to a landfill or recycle center. Read the product label for the proper PPE and disposal instructions for the pesticide you are using. You also need to wear PPE while you are cleaning your spray equipment. You will need to use a heavy detergent and scrub brush to remove residue from all external components on your spray equipment. If you have empty product containers, this is a good time to rinse them. Pour the rinsate into your spray tank and spray on a site listed on the label. Follow any additional instructions for cleaning your spray equipment as listed on the label. You will need to determine a proper cleaning agent for cleaning pesticide residue. First, read the product label for any required cleaners. Some common ones are household ammonia, which increases the solubility of some pesticides by raising pH. There are also commercial tank cleaners, which may be required. You can also use heavy detergent like Dawn dish soap. Here's a general procedure for cleaning spray equipment. Wear the PPE listed on the label while you clean your spray equipment. First, rinse the spray tank with a hose until the tank is about a quarter full. Add a detergent as listed on the product label. Agitate for a few minutes and run the mixture through the nozzles. Let sit for 15 minutes. Spray rinsate on a site listed on the label. Rinse again and spray on a site listed on the label. Remove nozzles and screens and place in a bucket with heavy detergent. Always follow the instructions listed on the product label, as this procedure can vary widely depending on the pesticide you are using. After all your equipment and product containers have been cleaned, you will need to clean your PPE. You need to have clean water and detergent available before you start spraying. You will first need to wash your gloved hands, then remove your outer layer of PPE. Wash gloved hands again, remove eyewear, wash your gloved hands, and then remove any remaining PPE. Wash all PPE with a detergent like Dawn dish soap and water while wearing your gloves. You may also want to wear eye protection at this step. Remove your gloves last. Hang your PPE up in the sun. Through photodegradation, solar rays will break down any remaining residue on the PPE. Discard any disposable PPE you used. Regardless of what PPE you were wearing, you will need to wash your clothing when you get home. Wash your clothing separate from your family's clothing using hot water and regular detergent. Rinse multiple times and follow up with an empty wash cycle to remove any remaining residues from the washer. An additional safety topic that we need to cover is first aid. It is important to understand first aid measures prior to applying the pesticide so you are prepared when an incident occurs. Always protect yourself first before assessing someone else so you don't also become a victim. When medical help is needed, be prepared with copies of the pesticide label so medical personnel can make informed decisions on treatment. After pesticide exposure, call poison control. They can walk you through any steps you need to take specific to the pesticide you used. There are a few basics which will help with most pesticides. If a pesticide gets in your mouth or on your skin, rinse with clean water. Do not ever put anything in an unconscious person's mouth. They could easily choke. Do not induce vomiting unless listed on the label. This can often cause worse damage to a person's esophagus and mouth. If a pesticide is inhaled, get to fresh air. It is always good to know CPR, especially for those of you who live or work far from available first responders. If you do call 911 and first responders come, they need to be informed of any PPE they need to protect themselves from the pesticide. Again, you do not want to create more patients. You should also have pesticide labels on hand so that anyone giving medical care has all pertinent information. Here is the first aid statement from Tordon 22K, another commonly used pesticide in Montana. This is a pretty limited description. You will have to use your own judgment outside of eye exposure, which is where knowledge of some basics is useful. If you get any pesticide on your skin, you should use soap and water to remove it as soon as possible. Not all pesticide application health issues are related to the pesticide you are using. Heat illness is also a major concern, especially when the gear you need to wear aggravates the heat issue. Heat illness can be broken into two categories. Initially, you may have heat exhaustion, which can then escalate to heat stroke. Both of these are serious conditions. Heat stroke can be fatal. There are a few things you can do to prevent this. Drink lots of water throughout the day, not just when you feel thirsty. Find methods to keep yourself cool, like including ice packs in your clothing, and keep cool drinks close to you. Do not trade your proper PPE to be cooler. These are two issues which need to be co-managed and both taken seriously. At this point in the video, you can pause and download the core topic story problem packet located on our website where this video is listed. You'll need to fill out the questions located on page 6 with the heading Pesticide Safety. You'll need to use the gramoxone label that starts on page 8. Once you have completed the story problem, press play on the video and we will go over the answers. The story problem scenario is Mr. Greenwood wishes to apply Gramoxone SL 2.0 for managing weeds on 10 acres. He is applying the product immediately prior to a grass seed planting. His pesticide spray equipment is calibrated at 20 gallons per acre, and some weeds are 9 inches high. Question 1. What is the signal word of Gramoxone SL 2.0? The signal word is danger poison. This can be found on page 8, or the first page of the Gramoxone label. Question 2. What respiratory equipment must he wear? The applicator must wear a dust mist NIOSH approved respirator with any NRP or HE filter. This can be found on page 10 of the label under PPE. Question 3. What additional PPE must Mr. Greenwood wear when mixing compared to applying the product? Mr. Greenwood must wear a chemical-resistant apron and face shield as listed on page 10 under PPE. Question 4. Mr. Greenwood smells something odd while wearing the respirator. What should he do? Mr. Greenwood should move to fresh air. The odor is from an added alerting agent, not from the paraquat. This is listed on page 9 under first aid. Question 5. Mr. Greenwood wishes to re-enter the field 18 hours after the application. Is it safe for him to re-enter without PPE? If not, what PPE does he need? There is an REI of 24 hours for pre-plant applications, so Mr. Greenwood needs to wear coveralls, shoes and socks, protective eyewear, and chemical-resistant gloves. This is listed on page 11 under Ag Use Requirements. This concludes our presentation of pesticide safety. If you have any additional questions, please contact your local Montana State University Extension agent or the Pesticide Education Program.